Hey everyone, and welcome to today's Explainer. We are jumping right into a totally massive and honestly fascinating shift happening right now in India's medical infrastructure. We're looking at a huge move by the central government, basically a comprehensive plan to completely revolutionize healthcare access outside of the country's major metros. For decades, the story of medical care in India has really just been a story of geography. It's a situation where your PIN code often literally dictates the quality of care you receive. But that is poised to change. So let's dive right into this and see exactly how policy is being rewritten from the ground up to build hospitals where they are needed the most. Because it's a pretty stark reality when you really think about it. Why do millions of people have to travel hours, sometimes cross entire state lines, just to get basic health care? Or even just a standard diagnostic test? I mean, we always hear about India's world-class medical tourism, right? Yet the domestic reality for a massive chunk of the population involves these grueling, exhausting journeys during their absolute most vulnerable moments. So this isn't just an inconvenience. We're talking about a matter of life and death. It really establishes the incredibly high human stakes of our current medical divide. And the disparity is just staggering. On one side of the coin, you have Tier 1 metros, cities like Delhi, Mumbai, Bengaluru, Chennai. These hubs boast world-class facilities, abundant hospital beds, cutting-edge technology, top-tier specialists, you name it. But then on the flip side, we have Tier 2 and Tier 3 cities. Despite housing just massive, booming populations, these areas are chronically underserved. They face severe infrastructure scarcity. You basically have this intense concentration of resources in a few megacities, which leaves a massive vacuum in the smaller towns. It's a profound structural imbalance that has defined the healthcare landscape for years. Section 1. The Great Healthcare Divide. Metros versus the rest of India. So we really need to explore exactly why this geographic disparity exists in the first place. Understanding the root cause is pretty much the only way we can understand the government's proposed solution. Now, you might intuitively think, well, smaller cities lack hospitals because there aren't enough patients. Or maybe there's just not enough money to be made there. Actually, scratch that. It is a complete misconception. The central problem isn't a lack of patient demand. The demand is overwhelmingly there. The actual roadblock, bureaucratic red tape. I mean, we've all dealt with government paperwork, right? Maybe waited in a DMV line for a bit too long, or filled out a form in triplicate. But historically, this massive bottleneck of complex government rules has completely discouraged healthcare investors from venturing into smaller towns. Setting up a hospital is incredibly capital-intensive. So when you combine those high upfront costs with an absolute maze of local regulations, investors simply choose to expand in established metros. Over there, the pathways, while still complex, are at least familiar to them. Section 2. Breaking the red tape. Dismantling the bureaucratic bottleneck. So how exactly do we fix this? Well, to understand the solution, we have to define a key term you are going to be hearing a whole lot: compliance overhaul. In plain language, it's basically a comprehensive redesign of government rules meant to drastically simplify and accelerate regulatory approvals. The really crucial point here is that this isn't about the government just writing blank checks to go build hospitals themselves. Instead, it is a total structural redesign of the rulebook. The goal is to make it infinitely easier for private developers and healthcare networks to enter these underserved markets. To put this into perspective, let's walk through the incredibly cumbersome old system of opening a hospital. Step 1 was navigating multiple local agencies. A hospital builder had to get separate clearances for fire safety, environmental impact, land use, water, electricity, often from completely disconnected local municipal bodies. Step 2 involved enduring incredibly lengthy waiting periods. Because these agencies didn't communicate with each other, the paperwork just stalled, adding months or even years to a project. Then Step 3. Deciphering complex building norms that were often super outdated or, frankly, utterly unsuited for the specific topography or reality of a Tier 2 or Tier 3 city. These friction points literally strangled development before ground was even broken. Section 3. The new compliance rules. Streamlining for growth. Recognizing this massive failure in the system, we are now entering a totally new phase of policy. Honestly, if you take away just one thing from this explainer, let it be this central shift. We are moving from the old way, which was fragmented, multi-agency approvals where files just get lost in basements, to the new way. The government is introducing a unified single-window clearance system. This is a real game changer. It's the single most important change. It means replacing that maze of disconnected agencies with one unified, digital, streamlined point of clearance for investors. You submit your plans once to one portal, and the back end handles all the interagency coordination. It completely changes the risk calculus for someone looking to invest in a smaller city. Let's break down the mechanics of this overhaul just a bit further. The whole policy is essentially built on three main pillars. First, as we just touched on, single window clearances are introduced. Second, we see eased local building norms. This means adjusting zoning and construction requirements to be way more practical and encouraging for medical infrastructure, obviously without compromising on safety. And third, accelerated approval timelines for investors. By legally capping the amount of time an agency actually has to approve or reject a proposal, the government is bringing certainty to the table. And in the business world, predictability is exactly what unlocks investment capital.
Section 4. Impact on local communities. Beyond the bureaucracy. Now, I know it's easy to get a bit lost in dry policy terms like compliance and single window, but this right here is the ultimate so what factor. When a new building code makes it easier to build a hospital, that translates directly to saving lives. First off, shorter travel times for critical patients. This means a 20-minute drive for a life-saving MRI or emergency trauma care, instead of a traumatic 2-hour journey to a metro. Second, it means the creation of local healthcare jobs. Hospitals require doctors, nurses, technicians, administrative staff, all of which keeps local talent right there in their hometowns. Third, we're talking significant economic boost to smaller towns. A large medical facility acts as a huge economic anchor. It spurs growth in all the surrounding businesses, like pharmacies, local housing, and transport. Section 5. The road ahead. Will the policy work? So, we've looked at the problem, the bureaucratic hurdles, and the government's proposed regulatory fixes. Now we have to adopt a bit of a forward-looking perspective and ask, will the policy actually work as intended? Well, the stated goal of the central government is ambitious and very clear. This policy overhaul is meant to act as the great equalizing factor for India's medical infrastructure. They are attempting to use regulatory simplification as a bridge to finally equalize healthcare access across all geographies, making absolutely sure that a citizen in a Tier 3 town has the exact same fundamental access to quality care as someone living right in the heart of a Tier 1 metro. It's a pretty brilliant strategy, using administrative efficiency to solve a massive physical infrastructure deficit. But I do want to leave you all with this final provocative thought. Will simplified rules be enough to truly bridge the healthcare gap? Cutting red tape is incredibly powerful, for sure. But remember, a hospital also needs reliable electricity, clean water, and most importantly, trained medical professionals who are actually willing to live and work in smaller cities. So is administrative ease the ultimate silver bullet? Or is it just the first necessary step in a much longer, way more complex journey to achieving nationwide healthcare equity? It's a massive question to ponder as we watch this whole policy roll out in real time. Thank you so much for joining me on this explainer, and as always, keep questioning, keep learning.